Hi, everyone. We're going to go ahead and get started. Welcome to today's webinar, Medicare and Job-Based Insurance, What You Need to Know. So very quickly, just about the Medicare Rights Center. The Medicare Rights Center is a national nonprofit consumer service organization that works to ensure access to affordable health care for older adults and people with disabilities. We do this through counseling and advocacy, educational programs, and public policy initiatives. My name is Derek Aya, and today I'll be leading our webinar. My colleague, Emily Wichlow, will be available in the chat if you've got questions related to the content or any Medicare questions, please feel free to type them into the chat and Emily will try to respond to them. We'll also take a few questions live at the end of the webinar. So please put in some questions and stay tuned for that. Last, I should say before getting started, that the slide deck of the webinar, so a PDF version of it, is already up and available. So if you navigate to the webinar page on medicareinteractive.org and you're logged in, you should be able to access the slide deck if you want to review these slides at a later time. Second, when it comes to not only the slide deck, but also the Q&A of the webinar, we will make sure that that is made available and also put on the webinar page. So today, what we'll learn, first, we'll start with Medicare basics, make sure that everyone has the same common understanding of the basic information, review the Part B special enrollment period and coordination of benefits basics. Then we're going to talk about current employer insurance, which we also refer to as job-based insurance, discuss retiree insurance, talk about COBRA, and then finally, we'll review a few case examples. So first, to start, Medicare basics. What is Medicare? As many of you are likely aware, Medicare is the federal program that provides health insurance for those who are 65 or older, or individuals under 65 who are receiving Social Security disability insurance, that's SSDI, for a certain amount of time, and those under 65 with end-stage renal disease or ESRD. There are no income qualifications for Medicare. Oftentimes, when we're talking about the income qualifications, we're actually talking about Medicaid, which is a separate program. And then there are two ways to receive your benefits. First is through Original Medicare. That's the traditional program that's offered directly through the federal government. The second way is Medicare Advantage. Medicare Advantage plans receive, when you're enrolled into them, you receive the same Medicare benefits, but through a private plan that contracts with the government. So when talking about Medicare eligibility, as I said before, there are generally going to be two ways. You're either over, you're 65 or older, or you're going to be under 65 and either collecting SSDI for a certain amount of time or eligible because you have ESRD. So if we look at the eligibility requirements when someone turns 65, you have to either be collecting or qualify to collect Social Security or railroad retirement benefits, or you have to be a current US resident and either a US citizen or a permanent US resident resident having lived in the US for 5 continuous years before you apply for Medicare. For those under 65 eligibility requirements, you either have been getting Social Security disability insurance for at least 24 months, or railroad disability annuity checks for at least 24 months, or if you've got ALS, then there's no waiting period and you're eligible to receive Medicare once you start receiving that SSDI. And the second way would be if you've got end-stage renal disease and you're under 65, and either you or a family member have enough work history in order to qualify for Medicare. Medicare is administered in 3 parts. Part A is the hospital insurance benefit. Part B is the doctor or outpatient benefit. And then Part D is the prescription drug benefit. Now, oftentimes people also know that the four parts of Medicare are parts A, B, C, and D. Part C is just another phrase for Medicare Advantage plans or another term for Medicare Advantage. These are ways to get your parts A, B, and often D through one private plan. As I mentioned earlier, they're companies that contract with the government. And it's important to keep in mind that Medicare Advantage is not a separate benefit. So you've still got Medicare if you enroll in Medicare Advantage, and you either choose Original Medicare or Medicare Advantage. You don't have both. There are four ways to enroll in Medicare. The first, which is just here briefly, is automatic enrollment. These are for individuals who, when they're turning 65, they're already collecting Social Security. And so Medicare will oftentimes automatically enroll them in their parts A and B. The second, the initial enrollment period, is a 7-month period, including 3 months before, the month of, and the 3 months following your 65th birthday. Coverage would start depending on when an individual enrolls in their IEP. And some people are automatically enrolled in parts A and B, as I mentioned before. But for many people, you'll be proactively enrolling during this IEP. So the chart here shows the example. If, say, my birth month is May, then the 3 months before, which would be February, March, and April, then May, the month of my birthday, and then the 3 months after, so June, July, and August, would make up my 7-month initial enrollment period. The next two, or the final two that were on that list, are the general enrollment period and the special enrollment period. And remember, we're talking about times to sign up for Medicare for the first time. I'm sure many of you are also familiar with fall open enrollment or the Medicare Advantage open enrollment period. There are various other periods for enrollment, but these are all periods where you can enroll in Medicare or sign up for the first time, right? So the general enrollment period happens January 1 through March 31st, and you can sign up for Part B with coverage beginning in July. Typically, you don't want to be using the GEP because using the GEP means that you'll incur a late enrollment penalty. So if you're using your initial enrollment period, or if you were automatically enrolled, then you've signed up for Medicare without incurring a Part B late enrollment penalty. But if you're using the GEP, that means you did not sign up during your initial enrollment period and you were not automatically enrolled. And so you had to wait until this January through March period in order to enroll in Medicare. The final way to enroll, which we're going to talk about a little bit more, is a special enrollment period. So special enrollment periods are times outside of normal enrollment periods that are triggered by specific circumstances. The last thing that I want to bring up as far as Medicare basics has to do with qualifying for premium-free Part A. So individuals qualify for premium-free Part A if they have at least 40 calendar quarters or 10 years of work in any job where they paid Social Security taxes in the US, are eligible for railroad retirement benefits, or if you've got a spouse that qualifies for premium-free Part A under number 1 or number 2 that's listed there. Typically, people talk about this as having your 10 years work history, but so long as you've got that 40 calendar quarters, then you're eligible for premium-free Part A. Beneficiaries who are Medicare eligible but do not meet any of the criteria above must pay a monthly premium for Part A, and that premium depends a bit as to how many calendar quarters you actually have. So next, as I said before, we're going to talk about the special enrollment period. This will be more important in the context of job-based insurance as we talk about it later. But as I was mentioning earlier, there is a special enrollment period where you can enroll in Medicare Part B for the first time. This special enrollment period does not carry a late enrollment penalty like using the general enrollment period does. So even though you're outside of your initial enrollment period, when you use the Part B SEP, you can get into Medicare Part B without owing a late enrollment penalty. Uh, in order to use or be eligible for the Part B SEP, you must first have insurance from current work. So that's a GHP from your, or a group health plan from your job, your spouse's job, or sometimes a family member's job. We'll get into those details later, or have had such insurance within the past 8 months. And you must have been continuously covered since becoming eligible for Medicare, including the month you became eligible for Medicare. So, what that essentially means is that you can't have a gap in GHP coverage of more than 8 consecutive months. The Part B special enrollment period is an 8 month period from the moment that you uh, typically from the moment that you've lost employer coverage or otherwise have retired from working, so you no longer have uh, insurance from current work. And so you've got an 8 month period in order to enroll in Part B. So if you don't have, or sorry, if you have more than 8 consecutive months without Part B coverage, then you're no longer eligible for that Part B SEP. That said, if you have shorter than 8 months of non-consecutive coverage, then you continue to be eligible for the Part B SEP. So to toss an example at you, if say you have a client or you yourself had job-based insurance when you turned 65 through 67, and then had a lapse of coverage for 4 months, but then got a new job and new job-based insurance because you did not have a gap of 8 consecutive months or more, you are still eligible for the Part B SEP should you choose to use it at a later period. So to use the Part B SEP, we've got the information here, but you typically will contact the Social Security Administration and request the following two forms. First is CMS 40B, which is the application for enrollment into Medicare. And then the second is the L564 form, which is a request for employment information. The beneficiary should fill out both forms, should fill out the 40B, and then the employer will fill out the L564. Both of these will go to Social Security in order to process your Part B enrollment via the special enrollment period. Now, I'll go over this briefly, but as many of you are aware, or all of you are aware, we're still in the public health emergency for coronavirus. And so you should contact Social Security offices to learn how to submit enrollment paperwork. Some offices have reopened for in-person appointments, but should also be able to receive mail and process enrollment paperwork. So send paperwork to a Social Security office by certified mail is typically the standard for making sure that it gets there. And if you cannot mail forms, you can fax them to Social Security. The number is 833-914-2016. So now we're going to talk about coordination of benefits. And coordination of benefits is a term that refers to the sharing of costs by two or more health plans. So how other health plans coordinate with Medicare is really what this topic of coordination of benefits is all about. And that can depend on whether a person's Medicare is based on age, disability, or ESRD, though for the purposes of this presentation, we're not going to discuss individuals who are Medicare eligible due to ESRD. We're going to focus on the age and disability only. And then it also depends on the kind of plan. So whether you've got a group health plan or retiree plan will change whether or not a plan is primary to Medicare or secondary to Medicare. It also depends on the size of the employer. So if the plan is for current employees, whether or not your employer has 10 employees or 30 employees will change whether or not Medicare is primary or secondary. For those of you who are maybe unfamiliar with the terminology, group health plan, and what that is, a group health plan is referring to a plan for uh, uh, or a plan through an employer or union for current or former employees. So GHPs typically are referring to both your current employer insurance, your job-based insurance, but it can also refer to some forms of retiree insurance as well. GHP refers to a plan of any size, so that term is fairly generic. For beneficiaries eligible for Medicare due to disability, a GHP for an employer with 100 plus employees is referred to as a large group health plan. And then how Medicare coordinates with group health plans for current employees depends on the size of the employer. So again, there are a lot of different terms, and as we start to go through the specifics of how all of this applies, I think it'll make more sense. But just think of a group health plan as a plan, whether or not it is from current insurance or for retiree insurance, that's coming from an employer or from a union. The other terms that matter as we talk about coordination of benefits are primary and secondary insurance. So when a beneficiary has Medicare and another type of insurance, Medicare is either primary or secondary for insurance for or primary or secondary insurer for medical claims. So the terms here are sort of self-explanatory. Primary insurance means that the insurance pays first on a claim. Secondary insurance means it pays after the primary insurer. Usually a secondary insurer will pay some of the cost left by the primary insurer or all of the costs that are remaining. So say, for example, I've got Medicare and I've got retiree insurance, and my Medicare is primary and my retiree insurance is secondary. Medicare, original Medicare typically pays 80% of the cost for services. So that leaves 20% for me. But if my retiree insurance is paying secondary, that means it may pay some or all of that remaining 20%, depending on the plan. That would include copays, deductibles, etc. If a primary insurer denies a claim, the secondary insurer may or may not make an independent determination on it, depending on the plan. So again, in that same scenario, my Medicare normally pays 80%, and say my secondary retiree insurance normally pays 20%. If Medicare denies payment, so it's saying it won't pay the 80% it normally does, then my secondary retiree insurance may still choose to pay whatever it normally pays out of that 20%. It really depends on the retiree insurance or whatever the secondary insurance would be in a specific case. The last term that's really important here is creditable coverage. This is drug coverage that's considered as good as or better than Part D. So individuals with creditable coverage will not have to pay a late enrollment penalty if they switch to Part D using the special enrollment period. And employer plans should send current and former employees annual notices declaring whether or not their drug coverage is still considered creditable. So this sort of matters for individuals who are delaying Medicare enrollment, And so perhaps they've got drug coverage through an employer plan currently, as many people do, or perhaps they've got drug coverage through a retiree plan or through a union, so on and so forth. If you're receiving drug coverage that is not Medicare's Part D drug coverage, but you are receiving a notice each year to say that your coverage is creditable, then you are allowed to delay enrollment into Part D, as in dog. You are eligible for a special enrollment period to enroll into Part D later on if you lose creditable drug coverage through no fault of your own, or your benefit is reduced and is no longer creditable. Now, for individuals who are delaying Part D enrollment without creditable coverage, so you've maybe got drug coverage from an employer or from a union or something like that, and you're not receiving that notice because your coverage is not creditable, you are not granted access to that special enrollment period to enroll in Medicare at a later time. So you would incur a late enrollment penalty. So this is sort of just an important note to keep in mind. We're going to talk a lot about the effects of delaying when you've got health insurance from an employer or retiree plan, but you should also be keeping in mind what the effects are of delaying your drug coverage if you've got employer insurance or retiree insurance or anything like that. So long as that insurance is creditable, then you're in the clear, you're able to delay Medicare enrollment or Medicare Part D enrollment and enroll at a later time using the SEP. However, if your coverage is not creditable, then you will have to incur a late enrollment penalty when you choose to enroll in Part D at a later time. So now, as I was just saying, we're going to talk more about the health side with the job-based insurance. So when we're talking about these scenarios, because we're going to go through a few, I think a bit of setup is actually really important. So for individuals who are turning 65 and becoming Medicare eligible, some of you, or maybe you're working with clients if you're a professional who has Medicare eligible clients, there are many people who may continue to work beyond 65 even as they become eligible for Medicare. And for those individuals who continue to work, oftentimes you've got an employer that has been providing you health coverage since before you became eligible for Medicare. And so then the question becomes, do I sign up for Medicare? Should I have both Medicare and my employer insurance? Should I disenroll from my employer insurance and just keep Medicare? Or can I just keep my employer insurance and not enroll in Medicare at all? What are the effects of delaying Medicare enrollment should I decide to? I think those are the questions that are typically on a person's mind when we're discussing this issue of Medicare and job-based insurance. And so what I'm going to go over are the rules as to how job-based insurance and Medicare work together when Medicare is primary, when job-based insurance is primary, and also the rules around that for if you're 65 or older, under 65 because you have a disability, and you're eligible for Medicare because you've been collecting Social Security disability insurance. And then in a later part of this webinar, we're going to discuss these same rules, but around Medicare and retiree insurance, which is the other bucket that many people who are becoming eligible for Medicare may find they have got questions about. They've got retiree insurance, or they've got federal employee health benefits, or COBRA, or something like that. But first, we're going to start with Medicare due to age and the rules for when Medicare is the primary payer. So if you've got job-based insurance and you're eligible for Medicare due to age, then Medicare pays primary when there are fewer than 20 employees at the company where you or your spouse works, or again, if you're dealing with clients where your client or their spouse is working. If an individual is eligible for Medicare due to a disability, then Medicare pays primary when there are fewer than 100 employees at the company where the beneficiary, the spouse, or another family member works. So in these cases, the job-based insurance or GHP based on current work is secondary to Medicare. I'm going to go over that just one more time because I saw that I may be moving a little too fast. So again, to just state it, if you're eligible for Medicare due to age and your employer has fewer than 20 employees, then Medicare is going to be paying primary. If you're eligible for Medicare due to a disability and your employer or your spouse's employer or family member's employer has fewer than 100 employees, then Medicare is again going to be primary. So these are the conditions where if you've got Medicare and you've got job-based insurance, or your spouse has job-based insurance, or in the case of someone who is under 65, a family member could also have job-based insurance that they're on. Medicare would be the primary payer, and it would be similar to that example that I gave you earlier, where Medicare is paying the majority of your healthcare costs, and your GHP is going to pick up copays or deductibles or whatever it is that GHP plan decides that it pays after Medicare has already made payment. So again, Medicare is primary for those who are covered by a GHP based on current work with fewer than 20 employees. That GHP can be an individual or a spouse's when someone is 65 or older. In this circumstance, an individual may decide to keep their GHP as secondary. In the example that I gave, if Medicare is paying 80% and you pay 20%, and your GHP decides that it pays your copays or it pays your coinsurances and deductibles, then it may be beneficial to keep Medicare. It would depend on how much you as an individual were paying for your premiums versus how much your GHP was covering for your cost sharing, right? Because Medicare is primary, an individual may have no health coverage if they decline Part B. So this is a really important point. Earlier, we were talking about primary and secondary payers, and as I explained it, the primary payer is going to pay a majority of the costs, and the secondary payer may cover your cost sharing, such as copays, deductibles, etc. If you're in a situation where Medicare is your primary payer and your GHP is just covering your copays and deductibles, and you decide to decline enrollment into Medicare, into enrollment into Part B, then your GHP plan is not required to pay whatever cost Medicare would normally pay. That means if you're turning 65 and you work for an employer that has fewer than 20 employees, but you decide to decline Part B, that means your employer insurance is not required to pay before Medicare. If it pays primary, it may be doing so because it doesn't recognize or know that you're eligible for Medicare. So it's doing so in error. And if your GHP learns that you are Medicare eligible, it can stop paying primary and recoup past payments. So for someone who's in this case, it's really important to enroll in Medicare to have Part B because that's your primary insurance. It's responsible for paying first on your healthcare costs. And then your GHP can pay secondary. It could be useful, again, you would be making that calculation based on what your GHP is paying, whether or not it's paying your cost sharing, deductibles, etc., in a way that works for you, and what your monthly premium for the GHP looks like. Keep in mind that the Part B special enrollment period still applies for this population. So earlier, when I was talking about the Part B SEP, this is an opportunity, right, to enroll in Part B later on. You can delay enrollment beyond your initial enrollment period. Uh, if you've delayed Part B enrollment and you've got this GHP that's only paying secondary, you still have access to the Part B SEP in this circumstance. So long as you've got insurance from current work while you're 65 or older and you haven't had that consecutive 8-month gap in coverage, then you still have access to a Part B special enrollment period. So the same circumstance, but for individuals who are under 65 and eligible for Medicare due to a disability, right? So these individuals, instead of fewer than 20 employees, it has to be fewer than 100 employees for Medicare to be primary for those covered under by a GHP from current work. Again, another big distinction here is that the GHP can be from your spouse's or another family member's current employment, while for those who are 65 or older, the GHP is only going to be from their own or their spouse's current employment. Other than that, the rules are more or less the same for how this looks if you decide to delay Medicare enrollment and only keep that GHP. Again, that GHP is secondary. It's not responsible for covering your healthcare costs as primary. Medicare in this circumstance is responsible for making primary payments, right? So after getting SDI for 24 months, an individual should be automatically enrolled into Parts A and B. Because Medicare is primary, you should keep Part B for outpatient care. Now, this is where there is one more nuance, which is that the Part B special enrollment period may still apply, but only if you're eligible for the SEP from health coverage through your own or a spouse's employer, not from another family member's. So this is another layer for those who are under 65 and eligible for Medicare due to a disability. If for whatever reason you decided to delay Medicare enrollment, again, it would depend on your circumstances, but we wouldn't recommend it because Medicare is the primary payer in this circumstance. So you would want to take Part B. But if you didn't take Part B for whatever reason, and you've got your GHP coverage through a family member, then you wouldn't be eligible for the Part B special enrollment period. And that would mean using the general enrollment period later in order to enroll in Part B, which could cause gaps in coverage and also would mean incurring a late enrollment penalty. In the other two cases, if you've got coverage through your own or a spouse's employer and you're under 65, you would still have that Part B SEP. But just like for the 65 plus folks, we would still suggest keeping Part B because that is your primary payer in this case. Now, there is an exception, and that's that job-based insurance plans that are secondary to Medicare don't have to provide the same health insurance for people eligible for Medicare. So the plan may choose to keep paying primary after an individual becomes eligible for Medicare. That's only if they agree to pay primary. And that in that case, an individual may not need to enroll in Part B. It's important to really get written confirmation from an employer or union uh, saying that the GHP will continue to pay primary, even though it's only a secondary payer, because you're either 65 or older and it's got fewer than 20 employees, or you're under 65 and it's got fewer than 100 employees. Again, this is a very narrow exception. It will be entirely dependent on the GHP you are enrolled in. And the most important thing would be to get regular written confirmation that your GHP was going to continue to pay primary, even though it is secondary to Medicare. So next, we're going to talk about Medicare as a secondary payer. So we've covered what happens if you continue to work or you've got insurance from your spouse or your family member because they're continuing to work and you're becoming eligible for Medicare, when Medicare would be primary. So in these scenarios, Medicare is the secondary payer and you can take Part B even if you've got primary coverage based on current employment. If you do take Part B in these following scenarios, it pays secondary. So Medicare would be covering cost sharing, including deductibles or copays possibly. And your employer insurance would be covering the bulk of your costs. So sort of a flip of the scenario I gave earlier before I was saying Medicare is paying 80%. It's not that your insurance, your employer insurance is necessarily paying 80%, but it is paying the majority because it is primary, and Medicare may pick up copays or other cost sharing. So talking about the scenario for Medicare secondary, if an individual is 65 or older, Medicare secondary and their GHP is primary if there are 20 or more employees at their employer. In this case, the individual is covered by their or their spouse's GHP, and they don't necessarily need to take Part B. You can delay enrollment because the Part B special enrollment period is there for you afterwards. And you've got your employer insurance as primary coverage, right? So in this circumstance, again, just as before, whether or not you choose to delay Medicare enrollment just depends on what is working best for you and your health insurance needs. You know that your employer insurance is your primary payer, so it's paying a majority of your health costs. Medicare may be useful to you as a secondary payer. It depends on how Medicare and your GHP work together. But a lot of people will often take Medicare Part A because it's premium free. So maybe it'll cover copays or co-insurances in the hospital. But mainly you're not paying out of pocket for Part A every month. And then some people may decide to take Part B. Others may choose to delay Part B, knowing that later on they can enroll in it using their SEP. And then that way they're not paying their monthly Part B premium as of yet. Again, the scenario is very similar for those who are under 65. In this case, you've got to have an employer of 100 or more employees in order for Medicare to be secondary and the GHP to be primary, or LGHP, large group health insurance or large group health plan. The individual can be covered by their spouses or another family member's LGHP, and they don't necessarily, again, need to take Part B. So you can delay Part B enrollment and use the special enrollment period for up to 8 months after you no longer have this coverage. So this, I think, is a really useful chart that breaks down how all of this works a bit more simply. So you've got the different scenarios on the far left side. You're either 65 and or older and currently working, or you're disabled and currently working, again, 65 and currently working, or your spouse is currently working, and disabled and currently working, or your spouse is currently working, or your family member is currently working. In the case where there are fewer than 20 employees for 65 and older, Medicare is primary and the GHP is secondary. In the case where you are disabled and currently working with fewer than 100 employees, Medicare again is still primary, GHP is secondary. In cases where you're 65 and currently working and there are 20 or more employees, or you're disabled and currently working and there are 100 or more employees, the GHP is going to be primary and Medicare is going to be secondary. Keep in mind that GHPs can choose to be primary regardless of an individual's eligibility for Medicare. But again, if you're interested in that, or if I shouldn't say if you're interested, if your GHP is offering to continue to be primary, even though you're working for an employer with fewer than 20 employees or fewer than 100 employees, then you should make sure to get that agreement in writing. Because otherwise those plans can recoup payments because they aren't responsible for paying primary. So that's Medicare and job-based insurance. So far, what we've been talking about is Medicare for individuals who are currently working, or their spouse, or in some cases family member, have continued to work and they're getting job-based insurance, meaning they're getting work through that current employment. Those individuals can delay Medicare enrollment, and in most cases, those individuals will have a Part B special enrollment period later on. But what we're going to talk about next with Medicare and COBRA, and some of the examples that come after, are for cases where individuals no longer have insurance through current work. Some of these, like COBRA, that like may have been related to some past history of work, but these aren't forms of insurance that are connected to someone who is currently employed. So retiree insurance, etc. So starting with COBRA, what is COBRA? It's the federal law that lets certain employees, their spouses, and their dependents keep group health plan coverage for 18 to 36 months after the individual leaves a job or loses coverage for certain reasons, as long as the individual pays the full cost of the premium. And COBRA only applies to large employers, so 20 plus employees. So COBRA is not insurance from current work, as I was saying before. What that ends up meaning is that COBRA is always secondary to Medicare. It's not like the job-based insurance we were discussing before, where there are scenarios where Medicare is primary and scenarios where Medicare is secondary. With COBRA, Medicare is always primary and COBRA is always secondary. And again, we're not talking about this in the context of people with Medicare and ESRD, for which there's different rules. There are different rules, but for individuals who are 65 or older, or under 65 and disabled, the rule is that COBRA is always secondary to Medicare. COBRA also does not qualify someone for the Part B special enrollment period. That means if you've got COBRA and say you turn 65, you're eligible for Medicare, but you've had COBRA since you turned 64 and you have a few months of COBRA left, you were planning to keep that COBRA and delay Medicare enrollment past your IEP. That doesn't work because you don't have a special enrollment period to enroll in Medicare later on. Unlike the job-based insurance scenarios where in most cases you have a Part B SEP, COBRA does not qualify you for one. Someone with COBRA who is eligible for Medicare should enroll in Part B within 8 months of losing their GHP from current work. So if you were continuing to work and past 65 and you had a GHP from current work and job-based insurance, and for whatever reason you lost that job and got COBRA, you would still have your 8-month Part B SEP to enroll in Medicare based on that earlier GHP. Um, but you would not get a new 8 months based on whenever COBRA ended. So you would have up to that 8 months in order to enroll in Medicare. But typically, again, you would want to enroll in Medicare as soon as possible, even if you did have COBRA, because COBRA is secondary to Medicare. So, like the examples I was giving before, where the secondary GHP does not have to pay primary, COBRA is not going to pay primary while you're eligible for Medicare. So you should be enrolling in Medicare as soon as you are eligible if you've got COBRA. So this is a list of the different qualifying events for COBRA, and you can see the maximum length of COBRA that you're granted based on each qualifying event. So if an employee retires, is terminated, or has a reduction in work hours, the maximum length of your COBRA is 18 months. If the employee develops a disability and has a reduction in work hours, again, it is 18 months. Employee develops a disability and is eligible for SSDI during the initial 18-month COBRA period. That's 18 months plus 11 months extra. And then if an employee's spouse and dependent children lose the employer group health plan because the employee becomes eligible for Medicare, employee and spouse are divorced, dependent child loses dependent child status, or employee dies, there's a maximum length of 36 months. So I was already discussing this a bit before, or sorry, no. So for individuals with COBRA who become Medicare eligible, COBRA usually ends on the date that the beneficiary gets Medicare. For beneficiaries with Medicare who become eligible for COBRA, they must be allowed to enroll into COBRA, and Medicare is going to be the primary payer. So what that means is that, say you're in a situation where you've already got Medicare Parts A and B, and anyone, maybe one of these qualifying events occurs, then where you become eligible for COBRA for a certain length of months, say 18 months, you retired or something like that, then you would be allowed to enroll in COBRA and use COBRA insurance. However, Medicare would still be your primary payer, as I explained before, and COBRA would be secondary, meaning that it may cover copays, deductibles, other cost sharing. However, if you're an individual with COBRA and you become eligible for Medicare, then COBRA is usually going to end on the date that you get your Medicare. So this is what I was talking about a bit before, which is around Part B enrollment. So Medicare eligible individuals with COBRA should take Medicare Part B because, again, Medicare is going to be primary. If an individual has COBRA in Part A, the COBRA policy may recoup payments if the individual doesn't sign up for Part B and the COBRA policy incorrectly pays as primary. Additionally, COBRA premiums are just expensive, so it can be more cost effective to enroll in Medicare with a Medigap and Part D after losing employer coverage instead of enrolling or maintaining COBRA coverage. An individual won't have a Part B premium penalty if they enroll during their 8-month SEP. So in the case that you were, say, retiring and you gained COBRA because of that, you would also presumably have a Part B special enrollment period, which you could use to enroll in Medicare without penalty. And so that last bullet especially is just trying to hammer home the idea that if you're eligible for COBRA, but you're also eligible for Medicare, you should be taking Medicare. It'll be more cost effective overall. And it's your primary payer regardless. Um, Again, as I mentioned earlier, especially in cases where you've already got Medicare and you become eligible for COBRA, you have the right to have your COBRA coverage as well as secondary. Um, but whether or not that's cost effective, considering the COBRA premiums are high versus how much they may pay for your copays, that's an individual decision to make, and it will depend on what your healthcare costs are. But you should keep those things in mind when you're trying to make Medicare enrollment decisions. So COBRA coverage may be terminated if a beneficiary gets Medicare, reaches the maximum coverage limit under the plan, which we went over earlier, becomes eligible for another employer and sponsored health plan, or does not pay their COBRA premiums on time. Coverage can also end if an employer stops coverage for all employees or goes out of business. So next, I'm going to talk about retiree insurance. So this is a broad bucket that covers many different types of insurance. All of them are insurance for former employees from the employer. So yeah, as I was just saying, it's provided to former employees who have retired. The big thing to note about retiree insurance is that it always pays secondary to Medicare. So very similar to COBRA, if you've got Medicare and you've got retiree insurance, then your Medicare is going to be primary. It's going to cover a majority of your healthcare costs, and your retiree insurance is going to be secondary. So it's going to cover co-pays, deductibles, other cost sharing possibly. This also means that when you're becoming eligible for Medicare, if you've had retiree insurance beforehand, it is typically going to be a good idea to sign up for Part B. So although Medicare is going to be primary, it may be beneficial to keep your retiree coverage as secondary. It can act as supplemental insurance and fill out gaps in your Medicare coverage. So again, covering those co-payments, deductibles, other cost sharing. It may also cover services that Medicare doesn't. For example, if you've got original Medicare does not cover dental coverage or does not provide dental coverage. But maybe you've got a retiree insurance plan that comes with dental insurance. And so you're getting that service through your retiree plan. It's always a good idea to check with your HR department or your benefits administrator to find out exactly how your retiree coverage will work with Medicare. Because again, each retiree coverage or each retiree plan is going to work a bit differently. Some of them, if you've got original Medicare where Medicare is paying 80% and you pay 20%, some of them may pay that 20% co-insurance totally. Some may pay 10% of it or something like that. Some may not coordinate with Medicare in that way. So it's important to check. And as I was hinting at a bit earlier, individuals with retiree insurance should be taking Part B. If the retiree plan is paying primary, it may not be aware that you are eligible for Medicare or that your client is eligible for Medicare. So the retiree plan can stop paying primary at any time and recoup prior payments that it made in error. Again, without Part B, an individual would not have primary health coverage. And so to avoid penalties and gaps in coverage, you should be taking Part B within 8 months of retiring. So during your special enrollment period, or if you turn 65 during your IEP, if you're not going to have coverage from a current employer moving forward. Now, there are a lot of different types of retiree insurance. Here are a few, and these sort of bigger categories of retiree insurance also work a bit differently from each other. So there's TRICARE for Life, which is for military retirees and dependents. TRICARE for Life requires that you take Parts A and Part B to have TFL, and Medicare is primary, as I was saying before. VA benefits or Veterans Affairs benefits. Individuals can have both Medicare and VA benefits, but they do not coordinate. So VA benefits only work at VA facilities, and Medicare will cover you at other facilities. So there are individuals who choose to have both of them, and they've got their VA benefits when they want to use the VA hospital or the VA pharmacy or something like that, or and they've got their Medicare benefits for all the rest, essentially. In that case, the VA benefits aren't going to be paying copays or coinsurances for Medicare, and Medicare is not going to be paying copays or coinsurances for VA, though they are separate. And then there are federal employee health benefits, or FEHB. There are several different types of plans for this. So there are HMOs, fee for service, etc. And Medicare is primary for those who take Medicare Part B. So if you do not take Medicare Part B, then FEHB remains primary. This depends a bit on the individual and their plan. Some people will choose to turn down Part B when they have FEHB, though, because they will be able to have primary insurance under the federal employee health benefits. That said, FEHB is not granting you a Part B special enrollment period. Retiree plans of any kind do not grant that Part B SEP. So if someone were to delay Medicare enrollment and use FEHB as primary moving forward, they would still have a late enrollment penalty in the future if they decided to enroll in Part B. We're going over these different buckets really briefly. There's certainly more to be said about federal employee health benefits, VA benefits, and TRICARE for Life. But the idea here is to just give you a sense that there's more nuance in the different kinds of retiree insurances that are available. So we're going to go quickly through a few case examples. I see that we're nearing 4, and so I want to make sure to take any questions that Emily may have saved for live. But case example number 1, Joseph is 42 and currently is on his sister's GHP and has VA benefits. He became eligible, Medicare eligible at 39, but did not take Part B because he was receiving most of his care from a VA facility. Recently, he received outpatient care at a non-VA hospital and found out he was billed for the full cost of his sister's GHP, or for the full cost, and his sister's GHP is offering no coverage. What's going on and what are Joseph's options? So the answer is that the GHP is likely from an employer with less than 100 employees, so Medicare is primary. Joseph should have taken Part B, but probably did not realize it because he was receiving care from the VA facilities. Because his GHP is from a family member, he's not eligible for the Part B SEP and will incur a late enrollment penalty for Part B coverage. The LEP will be wiped away when he enters his initial enrollment period. He has to decide whether or not to enroll in Part B now. So case example number 2, Kendall received COBRA coverage after retiring in January. She is 64 and turns 65 next year in June. When should Kendall enroll into Medicare coverage? So for this answer, Kendall is not currently Medicare eligible. She will have to wait until 3 months before her 65th birthday to enter her initial enrollment period. That means she has from March until September next year to enroll in Medicare coverage. If she enrolls early in her IEP, her coverage will start June 1st. Up until that point, her COBRA will continue to pay primary. She will lose COBRA coverage once enrolled into Medicare. Kendall has no Part B special enrollment period because she retired before becoming Medicare eligible. This is important because if she delays enrolling into Part B during her IEP, then she will have to wait until that general enrollment period to enroll, which means that she would have gaps in coverage and a late enrollment penalty. And then quickly, case example number 3, Jen works full-time at a restaurant and gets employer insurance. She recently turned 65, but plans to continue working. For most of the year, the restaurant only has 15 employees, but for holidays, the restaurant gets busier. For 5 months each year, there are 25 employees. Jen wants to know if her employer insurance counts as primary. So this is a really interesting case because many employers have flexible numbers of employees throughout the years, right? Or throughout the year, where sometimes they've got 10 and sometimes they've got 25. And so these rules that I mentioned earlier about, well, the employer has 20 or more employees, or it has 100 or more employees, how does that sort of apply to real world situations, right? And so for Medicare beneficiaries who have employer insurance and qualify due to age, so due to disability, there are different rules. If their place of employment has a fluctuating number of employees, Medicare has a 20-week rule. If the employer has 20 or more employees for at least a full 20 weeks in the year, then the GHP is primary and Medicare is secondary. If for those 5 months, which is 20 weeks total, Jen's employer has 20 or more employees, then her GHP is primary. So I'll go over these helpful resources really quickly. Medicare Interactive is the site that we're all on to visit this webinar, but it's our free online reference tool, more or less an encyclopedia of Medicare related information under that Get Answers section, as well as various toolkits and other resources that are available on our website. MI Pro is our paid online Medicare curriculum that takes you through a guided learning experience. So if you decide to become an MI Pro subscriber, you have access to quizzes, to test your knowledge, printable learning tools, etc. And then there's a survey, but I'm going to stop there to ask about questions.
Thanks so much, Derek, for that presentation, and everyone for your questions throughout. Oops, oh, Derek, I need to be a co-host to put my camera on.
Oh, yeah.
There are a couple questions that came in at the end that I didn't have a chance to type answers to, so I will just answer those live so that people, can make sure that they get their answers if they don't want to check back for the Q&A. So Daniel asked, will the penalty payment continue after you begin working and have medical insurance? So if you already owe a late enrollment penalty and you're over 65, that penalty doesn't go away if you get other insurance. You still owe that penalty for the time that you were uncovered, and you owe that penalty for the rest of your life. If you started working and you wanted to drop Part B while you had job-based insurance, you wouldn't get more of a penalty for dropping it because you already had the medical insurance for that time. But when you enrolled back in Part B after losing the job-based insurance again, you would have that premium penalty added back from those years before. Tom asks, I work for a large employer. I will work well past 65. I have excellent coverage. So should I enroll in Part A only? The answer to that is yes. That's usually what people do when they have primary insurance from work that they like. That's really good coverage. They often just enroll in Part A as secondary because Part A, as Derek explained earlier, is premium free for most people. And so you don't have to pay a monthly premium for it. You can just have that as secondary insurance in case you go to the hospital or a skilled nursing facility. And then lastly, Beth asks, I'm covered under my husband's federal employee health benefit, retiree benefits, and signed up for Part B. can I drop Part B? I'm wondering if it is necessary. And this is somewhat of a tricky question to answer, because if you have federal employee health benefits that are retiree benefits, if you drop Part B, if you ever want to enroll in Part B again, you would have a late enrollment penalty. So it's a question of, if you think that the federal employee health benefits are going to be fine for you and you're never going to want Part B, that's very hard to, predict, obviously. But if you think that the federal benefits will work for you, then you can drop Part B, but you'll just need to be aware that if you ever do want it in the future as, additional coverage, you would have a late enrollment penalty. And then just quickly, thank you to everyone who is still on. Really appreciate your time. Colin brought up a really good point about Part A enrollment being okay for people who already have primary paying job-based insurance, unless you're contributing to a health savings account, which I'll stick the link to our information about that on Medicare Interactive into the chat. A health savings account, if you are currently contributing to one, then you shouldn't enroll in Part A until you've had time to stop contributing to that account for 6 months. Otherwise, you'll get probably a tax penalty. You can't have Part A and make HSA contributions at the same time. That's an IRS rule, which you can read more about on Medicare Interactive. Great. So we will, again, make sure that these questions and answers are all typed up for you all. If you have others, you can always reach out to the Medicare Rights Center helpline. The number here I'll put in the chat, or you can check out Medicare Interactive for more information. Thanks everyone for your time, and thank you, Derek, for presenting.
Thank you, Emily. Have a good night, everyone.